Welcome back to Pain Diaries. I'm Dr. Suzanne Manzi, physician owner of Performance Pain and Sports Medicine in Houston, Texas. I am pleased to introduce my guest and colleague, Dr. Ankur Patel, one of the physician partners of Southern Spine with multiple offices in Georgia. Hey, Dr. Patel, thanks for being here with us today.
Hi, Suzanne. How are you?
Great, thank you. I'm so excited to showcase your journey as starting out as a pharmacist and then transitioning to a career in clinical medicine as an anesthesiologist turned pain doctor. So take us on that journey. It's definitely different.
Uh, yeah, for sure. Thank you, Dr. Manzi. I appreciate you allowing me to be on your show today. And, it's been quite the journey. I originally started out graduating from pharmacy school at Auburn University in Auburn, Alabama, and was looking forward to a long and rewarding career in the pharmacy world. I practiced pharmacy for about 6 to 7 years. I worked for a number of retail chains like Walgreens, CVS, Walmart. I also worked as a pharmacy technician in the hospital setting when I was in pharmacy school, and then I progressed on to owning my own drugstores, independent drugstores. And during my time in pharmacy, which was about, I would say, 15 years ago, that's when we didn't really have anything called the opioid epidemic. That there was no such thing. There was definitely no CDC guidelines. There was really not much scrutiny of opioids as there is today. And so it was a really interesting time to be involved in the pharmacy world as a pharmacist, filling large amounts of prescriptions and opioids specifically. It was at a time when pain was really thought of as the fifth vital sign, and physicians, not just pain management physicians, but really, primary care doctors, anyone with a medical degree was prescribing opioids in large amounts and really without much oversight and direction. So that really got me interested in pain management because I saw these prescriptions coming from pain doctors, and I thought, I'd really like to be on the other side of the pen, if you will, or the counter, being a pharmacist. So I ended up actually uh, selling my practices, going back to medical school after being out for almost 10 years, and doing completing medical school, doing a 4-year anesthesia residency, and completing a pain fellowship. And here we are today. So it's been definitely quite the journey.
Absolutely. No, I think it's fascinating because obviously, you chose pharmacy because of, how do drugs work and, what kind of effect do they have on patients and things like that. And then when you went to medical school, you kind of chose the same path with a drug-related type field being anesthesia, one of those instant opportunities to see how drugs react in patients.
Yeah, you're absolutely right. I think I was trying to decide in medical school, well, what route I want to go, surgical or being in more of a on the clinic side of medicine. I thought that anesthesia was a good complement to what I had already learned, to my current background. Being a pharmacist, I felt very comfortable with the physiology, with medications, their mechanism of action, how they work, the interactions, those types of things. So I chose anesthesiology as a residency field because I feel like when you think of us as physicians in general, most of the time, most physicians certainly prescribe prescriptions, but the prescription goes to the pharmacy and they never really administer the drug, if you will. But anesthesiology is really, in my opinion, the only specialty where we actually prescribe the drug and we administer the drug and we see the effects very immediately. And we really get to see the physiology and the mechanisms of action of the drug in real time and see its effects right away. So that really fascinated me, and I felt like it was a natural progression, from my pharmacy background.
Absolutely. And then, since we're both from different backgrounds, you being anesthesia, I'm physical medicine and rehab, You know, it's interesting how we kind of all lead to the same path of pain management and pain medicine and treating patients to ultimately be more functional and live better lives. So what then, I know the opioid epidemic is a big source of your fuel to turn you on to pain medicine and treating patients from that standpoint. And I think a lot of us, you know, in our age range right now as physicians, like we've seen that transition of pain is the fifth vital sign. These patients are on high dose opioids. How can we fix this? How can we be able to still treat patients the same way, but not necessarily with the same dosage, and still keep them functional and have a quality of life?
Yeah, well, I think one of the biggest things when I see patients who come in on high dose opioids, where someone down the line has been prescribing these, or throughout the years their doses have just escalated. Um, Biggest thing is setting expectations. I think a lot of times we all do it. In our busy practices, in our busy lives. Just communication. Yeah, I usually on the very first visit really set expectations with the patient of what are you looking to do here, what am I expecting from you, and what are you expecting from me, and we work towards a common goal. I think when the patient is actively involved in deciding how they would like to wean on medications, if I feel like they're at a really high dose, I let them tell me. I said, so what kind of schedule do you think, as long as it's within reason, and that it seems that okay, I think that's a gradual decrease, or that's not drastic, or that's too slow. Most patients really enjoy that you give them a little bit of autonomy. It first of all is getting them to buy into it. Second is for them to actually do it. And I think if you allow them to set that schedule, it really has made a difference in my practice. I've been able to wean patients, but also as we, I think, take something away, so to speak, what else can we provide? To answer the second part of your question is, emerging technologies. There are so many new things that are in our toolbox, if you will, today, that there is bound to be something that we can offer these patients. We have our traditional, in our pain management field, what we call bread and butter things such as epidurals and facet blocks and uh, you know, uh, major joint injections. But we now, obviously, neuromodulation has been around for a long time, things like a spinal cord stimulator. But we even have better, newer technologies, um, such as peripheral nerve stimulation. We have, I think, a person that was a guest that was on your program here earlier, talking about things as reactivate. So there's just VertiFlex, things like SI joint fusion. There's so many new technologies out on the market that I think we have to be proactive in teaching our patients there's more than just opioids.
Absolutely. I think it's so amazing. So in 2013, I remember one of my reps came in, he's like, you can now do ablation to the knee. And this was like this new technology, which I've now been doing for 10 years. I've done tons of them. But that was another thing that was added. Now we can do ablation to the joints, not just the axial spine area. So the knee, the hips, SI joints. And then it's just kind of transitioned into, okay, now there's another new technology. And then there's 2 or 3 more technologies that are evolving. And now, like you mentioned, the peripheral nerve stimulation, even for the chronic low back pain that we have.
Yep.
Intracept, the interspinous spacer devices. The list goes
Yep.
on and on now. Whereas we didn't even have this in 2012. When I came out in 2010, I had like 2 or 3 things I could use. Neuromodulation. Well, back then it didn't really work for back pain. Now we
Yeah.
can hone it into back pain. So we're so lucky that we've like lived through this transition and we're able to offer these things to patients.
Sure. I mean, I finished up fellowship in 2015, 16, and even then, a lot of these things, I mean, just in this
Mm-hmm.
last, seems about 6 to 7 years, things have, really the field has taken off, and we have so many new things that we can provide to these patients. So it's a really exciting time to be a pain management physician. I think our field is definitely growing by leaps and bounds. I don't see us slowing down anytime soon. Yeah, I'm amazed, that. our biggest obstacle many times is, of course, commercial insurance and things like that. It's things not in medicine, but things that sometimes are not always in our control. But I think we have a lot of good groups and out there that are on the front lines trying to get some of those things changed so that we can offer all of these technologies to our patients. And part of that is research and putting all of that together. And if we continually do research and prove ourselves and show the data, that's what's going to drive our field.
Oh, absolutely. And that's what has driven our field. I had a conversation with a patient earlier today, and I said, the 3 things I just listed that you're a candidate for that might benefit your pain, I was not even able to offer those 3 things 5 years ago. And they're like, wow, really? Like, yep. And it's just research driven, and we pair with industry because they help drive the research too, because they're promoting these products, and they're the ones that we rely on to help us help our patients. And
Yep.
it's been a good partnership. I know your practice does a lot of research, which is huge.
Yeah, we do. We actually have an entire research division called Horizon Clinical Research. My partner, Dr. Jordan Tate, she's very involved on the research side with some of the major industry partners. I am doing a little bit. She's definitely more well versed in it than I, so it's great to have a partner and a mentor like Dr. Tate, for sure. And then we have several other physicians in our practice who are also slowly getting into the research, because again, we realize that to continue to have a practice that's at the forefront and offering all the latest technologies, we really do need to be constantly learning and constantly doing research and being able to offer these latest improvements in our field to all of our patients.
Absolutely. My partner and I too, Dr. Matt Wiederholtz, again, it's great having a partner who continues to allow you to be better, to treat the patients better, and working together and really, embracing those research partnerships and moving the field forward. And I look to Dr. Tate as a good friend and a colleague through the WIPM society that we have as females, and she's an inspiration to other females around the country as well, which is pretty awesome.
Yeah, absolutely. Many times organizations such as WIPM and Aspen and some of the ones that are very active today will have like cadaver courses, will have like teaching labs and things like that over a weekend or at one of these conferences. And Dr. Tate and I joke, I sometimes I tell her, I said, yeah, I want to sign up for, this one, or I'd like to get, I'd like to hone my skills on this. And she jokes with me and says, well, you don't need to go to that. You've got me here, and I teach that. So I'm very lucky to have a partner who, I have a personal mentor and teacher right here. So it definitely makes it very convenient for me to step into the OR with her or us to work
Absolutely.
together on something. So
Yeah, she's
that's
awesome.
probably been, from a personal standpoint, I think that's been one of the biggest joys for me, is to partner with Dr. Tate. And it's definitely, taught me a lot on my, professional skills and things that where I've, always felt like I was a little lacking or I wanted to
Right.
know more. It's great to share that with a colleague like Dr. Tate in the same practice. So we look forward to, working together on some things.
Fantastic. Yeah, no, she speaks so highly of you. So thank you again so much for being on my show today. Anybody who's in Georgia, tell people where you're located. I know you have multiple locations.
Yeah, so we have 5 offices. I'm at our Gainesville, Georgia, and Athens, Georgia location. Dr. Jordan Tate, she's there in the middle in the picture. She's at our Jasper office. Dr. Smith is at our Noonan office, and Dr. Vade is also at our Noonan office. And then we also have several other providers, nurse practitioners in our practice. So we have 5 locations in and around the Atlanta metro area.
Fantastic. Well, thank you, Dr. Patel, for being here today. We look forward to seeing you again soon.
All right. Thank you, Dr. Manzi. I appreciate it.
Absolutely. This is Dr. Suzanne Manzi with Performance Pain and Sports Medicine in Houston, Texas. This is Pain Diaries. We're going to take a short break and we'll be back.